Hello, I am Dr. Bob Marcus with DDSGP, and today I'd like to talk about something very important: case acceptance. I call this straight talk. It's between me and you. I have met doctors from all over the country, even the world, and they universally tell me one thing they need in their office: new patients. Everybody's fighting for new patients. Well, here's the funny thing. If you can raise your case acceptance, you will automatically raise your new patients. What? How does that work? I'm going to tell you in a minute. But for now, I want to define case acceptance. We have doctors that fall into three classes when it comes to case acceptance. One, my case acceptance stinks. I am not getting patients to say yes. I'm presenting the case and they're saying I've got to wait, my insurance doesn't cover it, I got to think about it, or whatever. Patients just aren't coming back and getting stuff done. They're refusing treatment. They're declining treatment. Two, my case acceptance is so high. I have a 90% case acceptance. Now, that's a different problem. That usually means you're underdiagnosing. That means you're not talking to patients about all the things that are necessary to make their mouth perfectly healthy. Example, they have a bunch of wear. Are you talking about rehabilitating and putting the VDO back where it belongs? They have orthodontic problems, lower anterior especially, but they're 55. Are you presenting an ortho case so the teeth can last their whole life? Are you letting stuff go? Are you putting watches when you know it really needs treatment? You just didn't want to say it. Are you seeing a PFM where all the porcelain is rubbed off and we're down to 1/1000th of a millimeter of metal left, and you're saying, well, that's still serviceable. Let's just let it super erupt even more. You see, doctor, if you are afraid of hearing the answer no, so therefore you're not asking a question, your case acceptance will zoom up, but you'll end up doing small little non-productive treatments all day long. Your production will suffer and your busyness will increase. And then we have the third group. The third group is doctors who are just completely clueless about it. They have no idea. What's your case acceptance? I don't know. Because they don't know how to run the reports. Maybe they don't want to know how. Maybe they're afraid to look. But for whatever reason, they don't know. And this is a problem too. For this group, I have a suggestion. Your next 20 cases that you diagnose properly, write down the name of the patient and the total value of the case as presented. Then write down what portion of that was accepted. And by accepted, I mean paid for and scheduled. You'll notice the order of those. Totally separate video called prepay. Anyhow, at the end of about 20 cases, add it all up and see what percentage of what you recommended was paid for and scheduled. There's your case acceptance number. You don't even need any software. Metrics are very important, but that doesn't mean we need lengthy reports. That just means we need to do some math. So now I'm going to come back to what I said earlier, which is new patients' case acceptance are the same thing. You see, doctor, when you use DDSGP properly, and you understand the why of DDSGP, why are we using it? Not just what are we using it for? Your case acceptance will go up. And when case acceptance goes up, that means patients are saying yes because they trust you, because they want you to help them solve their problem. And inevitably, those very patients will send their friends, because nobody likes to talk about something more than a bad experience at the dentist or an excellent experience at the dentist. The middle of the road ones where we just say, you need a crown, here's how much, that does not bring in referrals. So if you haven't watched the Why DDSGP video, I encourage you to do so. You can find it on our website. For now, case acceptance, straight talk is what we're doing today. And doctor, if you're too low, DDSGP will help you because you'll be able to better present and have that shoulder-to-shoulder feeling. If you're too high, DDSGP will help you because you can take the harder items and present them to patients instead of just ignoring them during your exam. And if you're clueless, you have the tool I gave you, and let's see which class you fall into and get it fixed. You see, excellent case acceptance leads to excellent production, leads to practice success. And isn't that what we're here for? All the best.